So, the next question, we just finished talking about canines. The next question would be regarding local anesthetics. Local anesthetic patient has an adverse reaction, okay, to it. So, probably due to the preservative which is a methylparaben 1 milligram per milliliter. Prilocaine metabolite O-tolidine can cause methemoglobinemia. So we're gonna see adverse reaction in dentin NBD part 2. Adverse reaction. Okay, so local anesthetics. The adverse reaction side effects of local anesthetics either cause toxicity or allergy. Toxicities are caused by too much anesthetic in the bloodstream, affecting the central nervous system and cardiovascular system. The central nervous system toxicity effects are restlessness, stimulation, tremors, convulsive seizures followed by central nervous system depression, slower respiration, and even coma. These are the toxicity effects. Again, restlessness, stimulation, tremors, convulsive seizures followed by central nervous system depression, slowed respiration, and even coma. The cardiovascular effects of toxicities can be bradycardia and reduced cardiac output. Okay, now allergies to local anesthetics. The allergies are hypersensitivities and allergic reactions to local anesthetics, especially from amides, but they are rare. Okay, give me 1 second, I changed something here. Okay, I moved something. Let me see. Yeah, okay. Hypersensitivities and allergic reactions to local anesthetics, especially from amides. I'm trying to remember how to pronounce that. Let me see. Let's see how to pronounce.
Amides.
Amides. Okay, so we go back to where we were. So hypersensitivities and allergic reactions. Hypersensitivities and allergic reactions to anesthetics, specifically from amides, are rare. These reactions are manifested as dermatologic reactions and edema at the injection site. Asthmatic wheezing syndromes have occurred in response to local anesthetic injections. Allergic reactions are more prevalent with ester local anesthetics. Okay, and these are going to include nasolabial swelling, itching, and oral mucosa swelling, not amide location anesthetics. So the allergic reactions are more prevalent with ester. Okay. Now, bisulfites are the component of local anesthetic solution that causes the allergy. That's something to write. The component that causes the allergy are bisulfites. Patients may exhibit hypersensitivity to sulfites contained in some anesthetics. Sodium metabisulfite prevents the oxidation, which is the deterioration of the epivasoconstrictor. So, the in the case of uh, the sodium metabisulfite prevents the oxidation of the epinephrine vasoconstrictor in commercial preparations containing epinephrine. Most patients who react to bisulfites have a history of asthma, and the airway is hyperactive to the sulfites. Allergic reaction I'm going to write that down. Airway is hyperactive to sulfites. Okay. Most patients who react to bisulfites have a history of asthma, and the airway is hyperactive to the sulfites. Allergic reaction usually results in an asthmatic syndrome of wheezing and bronchial constriction. Bisulfites are present in only those commercial preparations with epinephrine. Preparations without epinephrine, like mepivacaine, do not contain bisulfites. Again, preparations without epinephrine, like mepivacaine, which is carbocaine. Remember, mepivacaine is carbocaine. MP. Mepivacaine is carbocaine. Carbocaine is mepivacaine. And these do not contain bisulfites. Hypersensitivity of allergic reactions to local anesthetics, especially amides, are much more rare than allergic reactions to bisulfites. Local anesthetics will reversibly block nerve impulse conduction and produce the reversible loss of sensation at the administration site. They are incorporated within the nerve membrane or bind to specific sodium ion channels, restricting sodium permeability in response to partial depolarization. Local anesthetics do not produce loss of consciousness. What is their mechanism of action? On the nerve axon, local anesthetics decrease the sodium uptake through the axon's sodium channels. When a local anesthetic is injected near the nerve, so when you have a local anesthetic and you inject it near the nerve, the solution interferes with the uptake of sodium from outside to the inside of the nerve by blocking the specific sodium channels. So the mechanism of action of a local anesthetic is to block the sodium receptor, so sodium cannot go inside the axon. So this decreases the nerve's excitability below a critical level, and nerve impulses fail to propagate along the axon. Since axons carry pain sensations, these sensations will not be carried, and a blockage of pain results. Local anesthetics have no effect on potassium at the nerve axon. So that's important. Local anesthetics have no action in potassium ions. Local anesthetic mechanism They decrease the pain sensation again by blocking propagation of nerve impulses. At therapeutic doses, locals at therapeutic doses, locally block voltage gated sodium channels to inhibit generation and conduction of action potentials. So they prevent the action potentials by blocking receptors of in sodium channels. So the sodium channels cannot go inside the axon to elicit an action potential, but they will not have anything to do with potassium. Local anesthetics help reduce saliva flow during operative procedures by reducing sensitivity and anxiety during tooth preparation. So they don't only act at have an effect on the local level, which is the reduction of sodium channels, but also when there's no pain, the patient will relax a little more and the salivation will increase. Local anesthetics depress small, unmyelinated nerve fibers that conduct pain and temperature sensations first, and they will depress myelinated fibers last. Small nerves have a greater surface volume ratio that accounts for the rapid onset of action. Clinically, the order of loss of function caused by local anesthetics is, again, clinically, the order of loss of function caused by local anesthetics is pain first, temperature later, then, first pain, second temperature, third touch, fourth proprioception, and fifth skeletal muscle tone. Pain, temperature, touch, proprioception, skeletal muscle tone. Pain threshold, the lowest level of pain a patient will detect. Now, what are the factors influencing absorption and effects? The site of injection, the pH in the area. If the area is acidic, the absorption of the local anesthetic will decrease. If the area has an alkaline pH, the absorption will increase. The extent of tissue vascularity and perfusion is also a factor that will influence the absorption and the effects of in the site of injection. So it is not the same if you put an injection in a highly vascular place, because it's very perfused. There's a lot of vascularity, so it will wash it away faster. Now, the effects of local inflammation or tissue damage, often a problem after injury. Now, what happens when there's inflammation? If there's inflammation, the pH is going to be lower surrounding the tissue that is inflamed, making it more difficult for local anesthetic to permeate the membranes. An inflamed acidic environment decreases the penetration of local anesthetic into the tissue. Thus, it's more difficult to achieve nerve block and satisfactory anesthesia in inflamed, injured tissue. Local anesthetics, in theory, are less effective in acutely inflamed tissue than in normal tissue, because inflamed tissue's pH decreases, which decreases the available free base. At body pH, which is 7.4, a local anesthetic, when unfiltered, will chemically exist as a portion which is ionized. Again, at a body pH, a local anesthetic, when infiltrated, will chemically exist as a portion which is ionized, which has a proton attached, which is merely a hydrogen atom. Okay, and as a non-ionized portion has no protons attached. The ionized portion has difficulty penetrating the nerve and will not be effective. Again, so at a body pH, a local anesthetic when infiltrated will chemically exist as a portion which is ionized and as a non-ionized portion. The ionized portion has difficulty penetrating the nerve and will not be effective. The non-ionized portion penetrates the nerve to cause anesthesia. This non-ionized portion is the free base. The more proportion of anesthetic in the free base form, the more effective the anesthetic. So when you put an infiltration, you want the highest possible amount of free base, because free base will be the portion that is not attached to protons. The portions that are attached to protons are attached to hydrogen and chemically are ionized at a 7.4 in a body that is 7.4 in pH. So when the conditions of our tissue are normal, this meaning a pH of 7.4, approximately 10 to 20% of the portion of an infiltrated local anesthetic is in the free base form, which is enough to penetrate the nerve to cause anesthesia. So when the tissue conditions are normal, 7.4, around 10 to 20% of this portion of the infiltrated local anesthetic is in the free form, which is enough to penetrate the nerve to cause anesthesia. When tissues are acidic, because of a tissue infection or whatever, there is less free base portion and more ionized portion. Thus, there is not enough free base form to penetrate the nerve to cause anesthesia. And the local anesthetic, when infiltrated into the tissue site, is ineffective at the normal anesthetic doses. So again, when the tissues are acidic, there is less free base existing. Okay, now let's see. A non-ionized form, which is a free base form, is a form that readily penetrates tissue membranes. Local anesthetic free bases are fat soluble, which are lipophilic drugs that are converted into their water-soluble hydrochloride salts to allow preparation of an injectable solution. Okay, again,